We've got some good and some not so good stuff to discuss with you, Health Secretary. And I want to start with a slight negative, and it was the fact that last week you were found guilty of unlawful conduct in relation to transparency over contracts about PPE and so on. You haven't apologised for unlawful conduct, which seems an extraordinary position for a cabinet minister to take. Why haven't you?
Well, no, I won't apologise, because to apologise would imply that I do something differently. And given the choices that we were faced with in April and May, when there were very, very serious problems with access to PPE, and some people were going without, and the team were working so hard to have taken some of the team off those life-saving work in order to complete the paperwork on time instead of just over a fortnight late, that would have been wrong. I understand
that, but you were found guilty of unlawful conduct. And it seems to me a strange situation where a cabinet minister representing a government is found guilty of unlawful conduct, but sees there's nothing to apologise for. I mean, surely, if you've broken the law, you should just say, look, I'm sorry I broke the law, but you seem determined not to do that.
Well, the reason is because if I were given my time again, and if I was given the choice between doing work that saved lives or filing the paperwork at exactly the right date, I would have done the same, and so would you, Piers. Everybody would have done the same.
I think you could, hang on, I think you could do both, can't you? I mean, surely you can try and get PPE, which we were chronically short of, and you can also ensure that your department doesn't break the law. I mean, why are the two things incompatible?
Because we were in a crisis. So the demand
that's your job in a crisis, is not to break the law and to do your job, isn't it?
My job's to save lives, Piers, and that's what we did.
Well, OK, well, let's come to that, because you also claimed...
Well, no, if you just let me answer the question. So the demand for PPE went up 10 times. So, of course, the team were massively stretched. And, of course, we hired into the team as well. But that itself takes, a couple of days to get people in. And would you have, given that choice, said, it's OK, don't worry about signing that contract because we've got this paperwork, because otherwise Piers Morgan might have a go at you in a few months' time? No chance.
Well, or someone might find that you have broken the law.
I find that an extraordinarily glib response to breaking the law. I would try and do both. I mean, you talk about PPE. You claimed on the Andrew Marr show that one of your justifications was that you had avoided any national shortage of PPE.
Yeah.
Well, that's just a barefaced lie, isn't it? We were chronically short of PPE. We hadn't prepared properly for this pandemic, and we got caught without enough PPE. We all know that. Why are you pretending that actually back in that first wave we had enough PPE?
I'm not at all. As I said just now, there were areas where it was enormously challenging, and there were areas where there were problems, but we never had a national outage of it. We were very close to that, but we didn't have a national outage of PPE.
What do you mean by a national outage? Because we had literally NHS staff having to use bin liners because they were seeing colleagues dying. I mean, look at this picture. I mean, that's what the reality was. I would honestly have more respect if you just said two things about all this, because I watched it on Andrew Marr. I couldn't believe what I was watching. If you just said, look, we did break the law, and I'm sorry for that, here's my reason, but that your excuse wasn't that you avoided a shortage of PPE, because you didn't avoid a shortage of PPE, which is why nearly 800 health workers have died.
No, so we never had a national outage of it because of my team and the work that they were doing. And yes, as I just said a couple of minutes ago, yes, there were problems in individual areas, and your photos are testament to that. In fact, those photos show exactly what we were fighting. We were fighting to get the PPE.
A shortage of PPE, Health Secretary.
Suzanne, honestly.
No, but you keep saying that there wasn't a shortage nationally. The point is, if there were shortages locally, an individual doctor or nurse or care worker, then there were shortages.
There were shortages locally. There was no national shortage because of the work my team did. And I back them 100%. I think actually it'd be better...
I don't understand how you're doing the maths.
Why do you sound so exasperated? You've just been caught breaking the law.
I sound exasperated for two reasons, Piers. One, because I think we should be on this programme thanking my team You know, they worked so hard.
Really?
And
Well, let's just analyse that, shall we? Your team. I'm sorry, if you want to play that game with us, your team, you and your team have presided over a woeful handling of this pandemic that has led to us having the worst death toll in Europe, 130,000 people dead. So I'm sorry if my first thought when you come on, Health Secretary, is not to thank you and your team for your brilliant handling of the pandemic, because I don't think 130,000 deaths shows that you've handled it well. And I'm sorry, I'm not thanking you and applauding you.
Well, so the second reason that I'm exasperated and answer in this way is because as soon as I start answering a question, you cut in and just said, when I said, can I ask the question, you said no. And what's the point in coming on if you're not going to allow me to answer the question?
Because you say there was no national shortage, and you say the pictures of health workers in bin liners shows there was a shortage. There's an inconsistency there. Let's move on to that.
No, it's totally obvious, and all your watchers know what I'm saying, which is, yes, there were individual problems. I know that, and that's what the team were sorting.
It's called a shortage. And it was happening, in very large numbers of parts of the country. I call that a national shortage.
I'll just keep finishing the answers.
Don't be so patronising, Health Secretary.
Well, we're
giving you the chance to answer, but when you give a completely disingenuous answer, we're going to call you out on it. You know that.
I know that I'm giving the answers to your listeners, even if you're just going to keep interrupting.
We have viewers, and we're only interrupting because actually you're giving disingenuous answers. Let's move on to something more positive.
We're not going to move on. I'm going to answer the point. My team, who are my PPE buying team in the department and across Whitehall, deserve our thanks and our praise. And when you do that, then we can move on from this subject.
OK, let's talk about your pub landlord, Alex Baum, who won £30 million in contracts to supply COVID test vials, despite having no prior experience for that. Initially denied that you and he had any contact via WhatsApp messaging, then admitted that you had. So what was your relationship with this guy, and what expertise did he have to deserve £30 million in contracts?
Well, as I've repeatedly said, I didn't have anything to do with that contract, and this has been looked into by the National Audit Office.
What was he messaging you about?
Confirmed that position.
What was he messaging you about?
But I didn't reply to the message. So, lots and lots of people have helped in this response, and all the people who came forward to help us as a country respond to this unprecedented challenge, they all deserve our thanks too. But all of this was done properly, it was done above board, and the National Audit Office have confirmed that.
I'm really struck by the fact that you feel incensed that we're not thanking you enough for your handling of this pandemic.
It's my team, actually, I was asking you to thank. I was asking you to thank the people who spent 18 hours a day, 7 days a week, for weeks on end, to make sure that we got the PPE that we needed and saved lives as a result.
You didn't save lives, did you? We've got 130,000 deaths, the worst death toll in Europe. We have one of the worst death rates in the world. We have nearly 1,000 health workers have died on the front line because they didn't, in many cases, have enough PPE. So I just don't know why I should be thanking you. You should be apologising.
Oh, honestly, you should listen to my answers. And I said you should thank my team, the PPE buying team in particular. And there is no evidence of a link from a lack of PPE to any of the frontline workers who very sadly have died. And this is an incredibly difficult pandemic for us to get through as a country. And I think it's incumbent on all of us, to recognise and acknowledge the public service that so many people have given.
I understand that people have worked hard, Health Secretary. I understand people have worked hard. What I'm really struggling with is your determination to be thanked for working hard in a pandemic when you're the Health Secretary, and for your refusal to just hold your hands up and say, I'm really sorry, we've got the worst death record in Europe. I mean, why don't you just say that? Rather than demanding thanks, why don't you just say, I'm sorry that we failed you, I will try and do better? Because that's more honest, isn't it?
Well, we constantly try to learn and do better, but you've got to learn the right lessons. And there's lots of lessons that we can learn. You know, for instance, we should learn the lesson, and I think this roadmap demonstrates it, that asymptomatic transmission of this disease is one of the big problems that we didn't know about, frankly, at the start. We also know far more that ventilation really matters, and hence the big focus in this roadmap on outdoors being more being much safer than indoors, and that underpins the roadmap. Of course, we also know a huge amount more about the vaccination program. And so, yes, absolutely, we learn all the time. But you've got to learn the right lessons. If we learned the lesson that we should put paperwork ahead of saving lives, that would be the wrong lesson. No, and so that's why I take the approach I do.
I understand. We just expect our cabinet ministers to abide by the law.